Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. My name is Mia Firna Alivia. I am student from Tanjung Pura University, majoring in forestry. This time, I will discuss a major problem that has been global since last year, namely the COVID-19 pandemic. COVID-19 is a disease caused by a new coronavirus that was not previously identified in humans. The emergence of the coronavirus was detected for the first time in China in early December 2019. At the time, a number of patients arrived at the hospital in Wuhan with symptoms of an unknown disease. Positive cases of corona or COVID-19 in Indonesia reached 8,607 cases. COVID-19 cases have spread in 34 provinces, with the most cases in DKI Jakarta. Indonesia first confirmed the COVID-19 case on Monday, March 2. At the time, President Joko Widodo or Jokowi announced that two Indonesians had tested positive for the coronavirus, namely a 31 years old woman and a 64 years old mother. The first case allegedly originated from a meeting of the 31-year-old woman with a Japanese citizen who entered Indonesian embassy in China to isolate Indonesians in Wuhan. In addition to the central level, local governments have also taken an alert step by alerting 100 hospitals. Preparedness was also carried out at 135 airports and international ports by installing body temperature detectors. Preventive measures are being carried out by tight supervision of the routes of entry to Indonesia from other countries including airports, ports, and land border crossing. Early detection as a form of surveillance was carried out especially for 19 areas that have direct access to China, namely Jakarta, Padang, Tarakan, Bandung, Jambi, Palembang, Denpasar, Surabaya, Batam, and Manado. To protect citizens from of transmission, President Joko Widodo established a regulation or large-scale social restriction drug government regulation number 21 of 2020 concerning large-scale social restriction and took effect from April 1, 2020. In order to prevent Indonesia's economic situation from becoming increasingly unfavorable, the government has begun to see the possibility of relaxing social restriction. In a closed meeting on May 27, 2020, President Joko Widodo asked the public to disseminate the new normal planning protocol. It is hoped the government's policy to implement the new normal will be in line with public awareness to maintain strict health protocols, because COVID-19 has not completely disappeared. Along with development of the pandemic, it is not known exactly when the COVID-19 pandemic will end. A number of issues stating that this pandemic is only a conspiracy have also become increasingly widespread. In fact, not a few people also believe in a conspiracy and do not believe in COVID-19, which has caused millions of people to be infected. Some of conspiracies that have been discussed since the beginning are related to the lack of biological laboratories in China. the development of biological weapons, the target of planting chips in the body, and so on. Although some of the conspiracy issues have been refuted by scientific evidence, some are still believed because they cannot be proven by facts. So, is it true the coronavirus pandemic is just a conspiracy? Apart from all the news that is now widely spread in the media, I feel the impact of this COVID-19. I feel my space and movement are limited, and I hope that this COVID-19 pandemic will soon pass and the world returns to health and safety.